Major funding for Battling Opioids has been provided by...
It doesn't take long to become addicted to opioids. In fact, 13 Pennsylvanians die from them every day. Geisinger is committed to ending opioid addiction with both prevention and treatment. In the last 3 years, we've reduced the amount of opioids we prescribe by 50%. And we've opened 3 medication-assisted treatment centers to help patients recover from addiction. Learn more at geisinger.org/hadenough.
Additional support has been provided by the Commonwealth of Pennsylvania and viewers like you. Thank you.
Tonight's program is a collaborative effort in which all 7 Pennsylvania public media organizations continue to focus on the opioid epidemic. Hello, I'm Paula Giangiacomo. Once again, we are here to discuss how Pennsylvanians statewide are confronting the epidemic of heroin and prescription opioid abuse. If you, a family member, or a friend are struggling with addiction, please call the Pennsylvania Get Help Now hotline at 1-800-662-HELP. Now, let's meet our panel. Senator Jean Yahl, representing the 23rd Senatorial District, serves on a number of boards and commissions, including chairman of the Center for Rural Pennsylvania. Senator Yahl is the prime sponsor of the opioid prescribing guidelines bill approved by the state Senate. It limits the prescription for a controlled substance containing an opioid. He also chairs public hearings on the growing heroin and opioid epidemic. Alexis Johnson was prescribed pain medication after a serious car accident. Alexis Johnson struggled with years of addiction, multiple overdoses, self-harm, and jail sentences. Today, after 3 years in recovery, she's a successful model and motivational speaker with a message that spreads hope to those who have fallen on hard times. Don Tollefson is a former Philadelphia sportscaster who knows he couldn't have gotten sober in prison without help. Now, he mentors and counsels people who are dealing with substance abuse issues. If you or someone you know needs help, please call the Pennsylvania Get Help Now hotline. The number is 1-800-662-HELP. The CDC has just released its current numbers on the number of overdoses in the nation, and it has risen 13% from 2016 to 2017. 70,000 people have died from drug overdoses. So obviously, this is a problem that's only getting worse. So I appreciate you guys being here to discuss this issue. You've all have dealt with it firsthand in one way or another. Senator Yahl, you have held hearings over the last 5 years to get a handle on the situation and to work to pass bills and to raise awareness and to encourage treatment and recovery. You had a recent hearing in October. What was the main theme that came out of that hearing? Is it to treat this opioid and heroin epidemic as a disease?
I think it emphasized that. As you said, the main purpose of all the hearings that we had was to educate people, to not to make opinions or to say this is the right way, but to make people aware of what's out there. What came out of the hearing that we had in October was clear indication from doctors that it's a disease. Addiction to opioids is a disease. We don't treat it like a disease. That's the politically correct thing to say. We pay lip service to it, but we really don't treat it the same as like somebody with diabetes.
And in France, they did treat it as a disease, and they saw numbers drop.
They saw them drop precipitously, and what they did that's different, and this ties into the other part that came out of the hearing, was medication-assisted treatment. We have drugs out there that will help addicts be able to live a normal lifestyle. And in France, what they did is they made the prescription of these drugs available down through the family practice doctors. And just think about what that does. That takes away the stigma. You don't have to go to a drug addiction specialist to get buprenorphine. You can get it from your family practice doctor. Well, that just has a whole lot of positives for it.
And these drugs help you cope with the withdrawal symptoms, help you wean off the opioid addiction?
And it may not be weaned off. Some people may need a maintenance course on a daily basis, just like people take medication for high blood pressure, people take medication for diabetes. And if drug addiction is a disease and is treated like a disease, then the fact that somebody may be on a maintenance level course of some offsetting drug, what's different about anything else that we do?
Mm-hmm. And stigma seems to be a huge barrier for people to get to a treatment center or to even begin thinking about recovery. Alexis, you started abusing opioids after a car accident. You were on your way to work, you were a bartender, you got into a car accident. What happened after that? What spiraled after that?
It started as a normal prescription painkiller, and I knew after my sister died, that's when the anxiety medication came into play too. So the car accident and my sister's death was 10 days of each other. And I learned as an addict that I really liked the way that those two drugs made me feel. And the less that I had, the more, and I use this term, the more like garbage I felt, and I couldn't figure out why. I didn't know about addiction in 2008. You know, I was mainly an alcohol drinker or a cocaine user. To have these sort of feelings happening within your body and you don't know what's causing it. So the pills got larger, the dosages got stronger, and I learned how to doctor shop, you know, because we didn't have these rules back then or the pharmacies checking prescriptions. So I would go to Luzerne County, I would go to Lackawanna County, I would travel, you know, to Danville to go to ERs and get these, you know, I had a pain management doctor plus a family practice doctor.
But now there's PDMPs, prescription drug monitoring programs, where when you go to a pharmacy, they can look up your history and basically prevent you from doctor shopping.
And it's much needed.
Do you think that's helped in this epidemic?
I would hope so. I don't see how it can. As long as the pharmacies and the doctors are following the way that they should. You know, I see scripts getting handed out like Pez, and I don't understand how, you know, like you're trying to give Suboxone for somebody who has a meth addiction. Like Suboxone has nothing to do with meth. You know, that's for an opiate withdrawal. But it just seems like in certain cases, you know, people want to hand out, there's kickbacks, I get it. But even when I relapsed from surgery, you know, if a doctor wants to hand you a prescription as an addict, more times than not, you're going to take it. And that's what I did, is I accepted the prescription, and I am accountable for that. But with the education, the awareness, if we put these systems into place, yes, I think it will help. You
could also resist opioids. You could also, you know, say to your doctor, I prefer something else.
Non-narcotics.
Exactly.
There are non-narcotics, and they work just as well as the narcotics do. It's just we as addicts would rather take something that would get you high, but they work just as well.
If you or someone you know needs help, please call the Pennsylvania Get Help Now hotline. The number is 1-800-662-HELP. Don, you've dealt with addiction. Yes. You're from the Philadelphia area. I grew up watching you. You're a popular sportscaster for the ABC affiliate in Philadelphia, WPVI. And now you help people, counsel them and get through their addiction. And you know firsthand how helpful this 1-800 number is. Tell me about that.
Yeah, when I work on the streets of Philadelphia, primarily in Kensington, which is the epicenter of the opioid epidemic for the entire country and all, if I get someone into detox, once I convince them to go into detox, normally in North Philadelphia, I have 5 days to navigate where they're going to go for drug rehab and all. And there are times when, even though I have good relationships with 11 great rehab companies, Geisinger, Malvern, Recovery Centers of America, Livengrin, many others, the insurance situation is very complicated. And they help navigate. I will call them, they'll talk to you, they'll follow up with you the same day, and then a week in they'll call to say, hey, in one case, is Steve K doing okay? They are phenomenal. But I do briefly want to pass out some quick kudos from the things that were just said. First of all, what you and the other stations are doing, the 7 public television stations, is remarkable, because off the air you are lobbying for the results of our discussions, for the solutions that we discuss. And Senator Yaw, I just have to say, working on the streets, there's so many addicts I run into who were high school athletes. Now, I had a car accident like you did, Alexis, but they're high school athletes. They tear an ACL. More and more of them are young women, because women's sports, as it should, has grown dramatically and all. And when they run out of their scripts, they are tempted to go get pills on the street. Pills are expensive on the street. You know, to get one Oxy, one Percocet, that may be $20, $25, $30 and all. Heroin's cheap.
Yep.
And the heroin dealers know that they can suck people in, so they give them free samples and get them addicted.
But the problem is, it's not just heroin that they're getting. Most of what they're getting is fentanyl,
80
which
to 90% in Philly.
500 times stronger than heroin, and it's totally synthetic.
Yeah.
It's coming from China. But good news is the president of China just issued a statement saying that anyone caught selling fentanyl will be prosecuted to the fullest extent of the law.
But what Senator Yaw did with this limiting of prescriptions is so important, because for many, many years, and I have to say frankly, Purdue Pharmaceuticals, the makers of OxyContin, for years had these pain management symposiums in the Caribbean. They would take doctors and other prescribing professionals and give them 30-day free coupons for OxyContin, which was their drug. 11
million people are abusing prescription medications.
Yeah.
So obviously there's a problem. But I want to get to our online question. This person wrote in, I suffer from severe chronic pain, migraines, insomnia, anxiety, and short-term memory. I have survived due to medical marijuana. Will legalizing marijuana help ease the opioid crisis while allowing patients to treat their pain in a way that works and is more affordable? This was emailed in from Barbara. What do you think, Senator Yaw?
I'll go along with the Secretary of Health's opinion, and she indicated that you know, medical marijuana is an approved treatment for opioid addiction, and so if it can lessen the withdrawal and help, I think that it's something that will work.
Now, throughout the state, this issue, it's not just, it doesn't discriminate. It's statewide. And Kensington, like you said, has one of the worst problems with the opioid, the worst with the opioid and heroin epidemic. And what I read is what Philadelphia can learn from these, from this overdose crisis is, you know, without a stable home, without access to broad-based treatment, and with a criminal record, and with this stigma that is attached to this, it can almost make recovery impossible. Alexis, did you find it difficult with the stigma, with getting to appointments, losing your driver's license, being, you know, in jail? Did that make your struggle harder?
Of course, and if you get multiple misdemeanors or felonies and you're as deep in the probation system as you can go, you know, if you're on a treatment court, and I am all for treatment court, it saved my life. But if you are a person that doesn't have access to a car, you have to get to court once a week. If you're on the caller system, you have to call every morning at 5 a.m. If your caller was called, you have to go produce a urine sample and an alcohol test. So for somebody who, let's say, lives in Carbondale, and probation's base in Lackawanna County is in Scranton, you might not always have a way down there. If you have children, you're a single mom, there's nobody to watch the kids. So I was lucky that I had my parents that helped me. Most people that are trying in early recovery don't have a stable support group. Or if you're trying to get a job and you have felonies, a lot of places are not going to hire you.
Yeah, they do background checks.
Right, and if they do hire you, they're the places that drugs run rampant in. Factories, restaurants. Restaurants are one of the biggest places for cocaine use. So, and normally they don't look at felonies. So we have now this addict or alcoholic is trying to get sober. They don't have a driver's license. They need a job to pay their fines and costs, but they can only get hired at a restaurant. Some catastrophic event happens in their life, and as much as we want to hope they have coping skills to not relapse, it's just not the way.
So what do they do?
What she points out is exactly the problem, and the reason the Center for Rural Pennsylvania became involved in this is that the more rural areas,
it's even harder to get to places.
And the only way you can get around is to drive, and you may need to drive where in a more urban area, 15 minutes to go across town or something. In a more rural area, it's an hour or more. And if you don't have a driver's license, and there's no, cabs aren't readily available, nor is Uber or any of those things in rural Pennsylvania, and not in my area of Pennsylvania or Elk County or Tioga County. It just piles on top of things. There's no question about it.
I just read that President Trump just signed the Support for Patients and Community Act, which is supposed to expand the type of things that are offered at these treatment centers, like job training, addiction treatment. It curbs drug shipments from entering the country. It lifts treatment restrictions for these treatment centers. What do you think of this new law?
I think the new law addresses a lot of things, but just in a very brief reading, the summary of it, I think that it's more directed towards the supply side rather than the demand side. And one example I will give you, go back to medication-assisted treatment. One of the problems with prescribing Suboxone that doctors have is you have to have a special approval from the federal government in order to be able to prescribe it. And then on top of that, you're limited with the number of patients that you can give it to. So you have this double standard here for this. And the new bill expands the ability to prescribe Suboxone to midwives, to nurse practitioners, and to physician's assistants. What makes no sense about this to me is that you have somebody that can prescribe an unlimited amount of opioids, but yet the treatment for it is limited. I'm just not sure how that came about.
Well, more than 900,000 people are abusing heroin in our nation. So if you or someone you know needs help, call the Pennsylvania Get Help Now hotline at 1-800-662-HELP. Don, you work with several hospitals in Philadelphia, and you even recently have trained volunteers to work with addicts. There's a thing called warm handoff. So when someone enters the ER and they've overdosed, they're not just treated and sent on their way. They're actually introduced to a social worker who would help them get to treatment. Can you talk a little bit about how that warm handoff works?
Yeah, what happens in the hospitals I'm working with in Philadelphia, and we have so many great hospitals there, is that when a person survives an overdose, instead of in a chaotic emergency room world that they all exist in, instead of discharging them because they're so busy, they involve other professionals, social workers included, who can really help not only give the person specific resources for the exact street where they were found dying of a heroin overdose on, but they can also set up a follow-up system. They can get their phone numbers, they can make calls, they can track them, find out how they're doing. They have outreach people who can go to the streets and all. But it's interesting that you mentioned my volunteers, and this transportation issue, even in a city with a lot of public transit, is an important one. But what I've been able to do with my volunteers is get them involved in providing transportation. And the great beauty of that in a secondary way is that when I speak at rehabs, I always say the most important people in sustaining your recovery, as wonderful as these professionals are who saved my life, it's the other recovering addicts and all. So you boost each other's confidence, and in that ride, I can't tell you how many times I've had one of my patients who has continued to turn a positive corner say, you know, when that person picked me up and drove me to rehab or drove me to the hospital for a doctor's appointment, all we did was talk about how they got their recovery going and sustained it. And as you know, Paul, I'm 1,890 days clean and sober.
Congratulations.
And we also, thank you, we also have these volunteers driving them to Alcoholics Anonymous and Narcotics Anonymous, because in those programs they say the first 90 days out of rehab you should go to 90 meetings. I think that's short-sighted. If you're 1,890 days, you should be going, as I have to, in my case, since I speak a lot, over 2,000. A meeting a day with other recovering addicts is key to your recovery.
Sure, well, that's great that you have so many volunteers.
Yeah,
let's get to our second online question. Per the CDC, the epidemic is worsening. So what new interventions with money from the state will help reduce Pennsylvania overdoses? This is from Leanne. Senator Yaw, would you like to tackle that one?
There's a little bit of irony in this. When the PDMP, excuse me, came online,
That's the Prescription Drug Monitoring Program.
we kind of knew that there was going to be an equal and opposite reaction to that people would go to illegal drugs, and I think that that's happened.
Right, if you can't get it from your pharmacy, you're going to go
That's
for
correct.
the heroin
And
on the
so
street, which is cheaper.
What's going to happen, I think, until all these things get in place and all the little things that we're talking about doing, there is going to be a reaction to it, and it's not going to be good. But I think that it's one of those things that you have to, we have to go through the pain of getting all these things in place before we can really start getting a grasp on it. So I hate to see the death rate go up. I mean, it's sad. It's really sad. It's like somebody said the other day, we'd get more attention if we lose about 170 people a day. If we had a plane crash every day, that would, people would listen to it. Mm-hmm. But I think that we're working at it. It's
well, there's the stigma out there. I've heard a lot of people say since airing these programs, this is our second statewide program, you know, people will say, well, these addicts have a choice. It's not like they were born with a peanut allergy. They have a choice to go do drugs. And I'm sure you might have even heard that, Alexis. What do you say to those naysayers out there who don't want to believe that this is a disease, like you say, Senator Yaw?
There's a lot of places I can go with this. Well, it is a choice that turns into a disease. It does change the chemical makeup of your brain. That's a proven fact. A couple of examples, there was a major university, and I can't remember the name, they studied the effects of crack cocaine on a regular human being and a person who was highly addicted to crack cocaine. And they put both of these people under, and then they said to the person who was not addicted, they whispered crack in their ear. To the person who was addicted, they did the same thing. And the brain scans of these two people were so astronomically different. The person who was addicted to crack cocaine, all the frontal, all the lobes of the brain that respond to pleasure lit up like a Christmas tree. Right. For the person not addicted, the brain chemistry was next to nothing. So
yes, you can be predisposed to
I believe so, yes.
an addiction.
I mean, a lot of things.
Genetic composition.
Right. And I'm finding, too, a lot of children are growing up in drug-addicted homes. So
they think it's okay.
Correct. There's 75,000 children being raised by either the state or their grandparents in Pennsylvania for the year 2018. So now, once we get rid of this epidemic, we're going to have a whole generation of children growing up with mental health issues because, you know, mom or dad died to a drug overdose, or dad was in state prison for 10 years. Right. So now I believe out of the thousands of people I have spoken to that are drug addicts or alcoholics, every single one has either started because they had a void to fill, some kind of trauma, or they grew up thinking it was okay. And I know when I was filling some kind of trauma from my childhood when I started drinking. I wanted to fit in because I was bullied all through school. I didn't know what real friendships were. So every child I have found that grows up into an addict or alcoholic does start for a reason. Nobody wakes up and says, yep, I'm gonna go screw up my life today and become a heroin addict.
It starts with issues,
right?
It starts with issues stemming from your childhood, which is why it's so important to, if you can, grow up in a stable home. But not everyone has that opportunity.
Right. I mean, the divorce rate is so high, so that trickles down. And I'm a high school speaker.
I didn't want to cut you off.
No, you're fine. So I believe preventative, too, is just as important as the education that we're doing.
Well,
that's what we're trying to do with these programs, is raise awareness and educate.
The idea that everybody's makeup is different. You know, you react differently to an opioid than what I might react to an opioid. It's the same way I might have high blood pressure, right. You don't.
Right.
All of our bodies are different. That's what makes it so insidious, that treatment that may work for somebody is not going to work for the
right.
person sitting right next to them.
It's not
right.
it's not a all-for-one type of treatment. But I wanted to find out exactly how you finally, came out of the darkness and fully recovered. What was it for you that helped?
I spent 14 months in jail and rehab, and I took myself out of society for a year at the Salvation Army. I didn't have a phone, I didn't have a car. I did a geographical location change to Harrisburg. Unfortunately, all my friends that I have used with or were my dealers in the past 3 years have died to heroin overdoses. So I literally picked up and said, this is for me. I don't want to do this anymore. I want a better life. And I had to be ready to make that change. But what I do want to make very clear is a lot of people say, well, you can't help the addict until they're willing. All the times I was on treatment court, all the times I was in jail, the one time I was in rehab prior to that, don't think for 1 second those seeds weren't planted in my head. I heard what they were saying. I was learning the tools. I just wasn't ready to be sober yet. So yes, you can't force an addict to get clean, but the more we try and provide these programs, even if they relapse, don't think that we lose that information. And I'm speaking as an addict.
How did you become a successful model?
When I was at the Salvation Army, I used to research photographers, and I always wanted to be a fitness model. So I would walk 3 miles to the library, and I would look up fitness photos, and then I would look at the photographer credit, and I would wait until I got somewhat in shape, and then I would reach out to the photographers and say, this is my story. Some would say, nope, you're not what I'm looking for. Others would say, yes, when you can, come up and we'll do a photo shoot. The first photo shoot I did landed a magazine cover, and it just skyrocketed.
And now it's your story that's actually bringing you attention more than your figure.
Yes, yeah.
Well, it's encouraging to see that so many entities are starting now to work together to combat this problem. And it is very important for people like you to come forward, come on shows like this, talk about your personal stories and all that you're doing to combat this issue. And we can't thank you enough. And we commend you for all the work that you're doing in Philadelphia and for your road to recovery and success and for all you're doing in rural Pennsylvania and what you continue to do.
We keep trying.
Thank you. I would like to thank our panel members for being a part of this important discussion. As a reminder, if you or a family member or a friend are struggling with addiction, call the Pennsylvania Get Help Now hotline at 1-800-662-HELP. Please stay with us for a special encore presentation of Part 1 of Battling Opioids, a project of Pennsylvania Public Media, coming up next. I'm Paula Giangiacomo. Thank you for watching.
Major funding for Battling Opioids has been provided by...
It doesn't take long to become addicted to opioids. In fact, 13 Pennsylvanians die from them every day. Geisinger is committed to ending opioid addiction with both prevention and treatment. In the last 3 years, we've reduced the amount of opioids we prescribe by 50%. And we've opened 3 medication-assisted treatment centers to help patients recover from addiction. Learn more at geisinger.org/hadenough.
Additional support has been provided by the Commonwealth of Pennsylvania and viewers like you. Thank you.
It could be your sister, your child, your parent, your grandparent, your neighbor, even your colleague. Opioids do not discriminate. The opioid crisis has become a nationwide issue. It was declared a public health emergency by President Trump in October 2017 and a disaster emergency in Pennsylvania by Governor Wolf in January of 2018. The CDC notes Pennsylvania is one of the 5 states hit hardest by the opioid epidemic, and it is seeing increases in overdoses across age groups, racial ethnic groups, and in urban and rural areas. In Pennsylvania, approximately 13 people die a day from an opioid overdose, according to a study from the University of Pittsburgh. Pennsylvania's 7 public media stations have joined together with the Commonwealth of Pennsylvania to confront this crisis head on. In this program, we'll tell compelling personal stories of hope and survival. In addition, we'll provide information and help direct people to the resources they need. After being involved in a serious car accident, Alexis Johnson was prescribed pain medication. She struggled with years of addiction, multiple overdoses, and jail sentences. Today, she is a successful model and a motivational speaker with a message that spreads hope. And for children with parents battling addiction, the crisis can be even harder to overcome. As the number of people struggling with opioid addiction increases, so does the number of children entering the foster care system. We sat down with a teenage girl who lost both parents to drug use. She ended up in the foster care system and has been struggling to find her way. Meet Alexis Johnson and Paris.
So I was born in Scranton, Pennsylvania, and I grew up in Archibald, Pennsylvania. And I had a beautiful upbringing. I had my life ahead of me. I came from a good family. There was really no drug use in my family. Where my life really took a turn for the worse was when opioids were introduced into my life. I was working at a bar in Scranton, and I was rushing to get to work. I was running late, and I hit a really bad rainstorm, and I hydroplaned. It was an extremely bad car accident. I was prescribed Xanax and Percocet for everything that had happened, and that's where I learned how to start abusing doctor-prescribed medication. In 2008, I didn't know anything about addiction. I wasn't aware of what was happening to my body. I just knew that I didn't have this pill, and I felt like garbage. So when I took the pills, I felt better. And then, you know, you get more pills and your dosage goes higher, and then you start taking more. And at one point in time, I was actually getting over 600 Percocets a month, and it got ridiculously out of control. The pills weren't working anymore, so I ended up graduating to heroin. I started off sniffing it and eventually started shooting it. I would cry to God every day to take my life. I would sit in a mirror and just pick and pick. I actually took an X-Acto knife to my face, and I cut my face here and all over. I have a massive scar. I look like the Night of the Living Dead. I was a walking corpse. My life now is awesome. At almost 3 years sober, it feels incredible. Fitness is such a huge passion of mine. I love bodybuilding, but I also love pushing myself way past limits. It breaks me down, it builds me up. It's cool because I've been able to smash a lot of barriers in the fitness world for recovering addicts. I did my first fitness competition in April of last year. It's WBFF, which stands for World Beauty Fitness and Fashion Federation. I came in top 15 for my first competition. I have been in numerous publications. I've been on the cover of magazines, and Status Fitness magazine did a huge article on me about my story. You know, the addiction used to be such a taboo, and now when I do these photo shoots, everybody wants to bring my story into it. My biggest modeling accomplishment, Playboy Australia 2018. I'm one of the first models that they were able to do the story on addiction. Everybody, including women, have supported it because of the integrity and my message and wanting to motivational speak and help teens. My goal in life is to help people and give back. What I've been through in my life is probably worse than most people have nightmares about. I've overcome so much. My only goal today is to make sure that kids don't walk down the same path I did.
A lot of my childhood has holes in it. I don't really remember. I remember pretty much the traumatic things more than the good things. I don't even think I could tell you one good thing about my childhood, to be honest with you. I saw a lot of things that I shouldn't have. I have seen things that I don't even think I should see now at my age. I went to parties with him because that was my dad, and I didn't want to be without him. I remember some days I would just wait by the window to see when he was coming home, and sometimes he didn't at all. Sometimes he stayed out. When I would go to parties, I think I would be the only kid there. He would be drunk and doing whatever, and there were some parties where I just couldn't find him, and I was alone, and I can't imagine the things that could have happened to me.
We do not have enough families to meet the need because we need families for our teen population. Those are the ones that's harder to find family for, because family will come forward for the newborns, and they'll come forward to the 4- and 5-year-olds, but they're not coming forward to the 14 and 15-year-olds. And all the agencies struggle with this.
I definitely had to get used to it because I wasn't used to the whole family aspect, and the kids just clung to me, and I wasn't really used to that either because I never really had healthy relationships.
She never got to be a kid, never. My early childhood memory is Disney World. Her early childhood memory is calling a prison looking for her mom. So she went right from being a little child to doing adult things. And statistics say that, she has an uphill battle. Statistics say teenage pregnancy, poverty, homelessness, drug abuse, alcoholism. So do I worry because I'm educated on what can happen? That's why I'm worried.
We really try to educate our families because they don't understand sometimes that you can take the child out of their environment and they can be with you 3 or 4 months, but that's not enough time, especially if you have a 14-year-old that maybe has been living in a situation that's been chaotic most of their lives. It's going to take a while to unpack that bag for them. It might take a year or more as they kind of adjust to your home and you adjust to them, and they don't feel safe a lot of times, so they challenge you for that. So it does take time to kind of help them and get the services they need and help them to know that this person is going to stay with them and not leave them. And that's ideally what we hope to get from our foster families, that they can just look at them and say, there is no one like you, and I will always care for you. And that makes a huge difference.
Technology is now used in battling opioid addiction. Today, pharmacists can now lead the charge in helping those addicted to prescription pain medication get treatment thanks to prescription drug monitoring programs. But first, hear the story of a former well-known sportscaster from Philadelphia, Don Tollefson. After his addictions landed the famed television personality in prison, Tollefson wanted to find a way to give back.
Active addiction is a really bad horror movie. In my case, the fact that I could go on television and do the sports or the news after I had consumed alcohol and or drugs continually convinced my addictive mind and my delusional mind that I was okay. My name is Don Tollefson, and I'm a recovering alcoholic, drug addict, and an ex-felon. I came to Action News in 1975, was there for 15 years, and then worked for the Philadelphia Eagles as a preseason play-by-play announcer and a stadium announcer until 2012. I was making terrible decisions. I had a big gulp of vodka with a little tonic, and I'd start popping pills, and I started over-promoting what it was I could do for the donors, and all of a sudden in 2013 I realized that I was in a position where I couldn't come through on these trips and these tickets that I owed them. Some people went to the police, and I was indicted by the grand jury. I was charged with 2 felonies of theft by deception.
I am Shauna Roeder, and we're in Harleysville, Pennsylvania. My parents had started a ministry for inmates, and they knew that he was in prison, so they reached out to him after he got out of prison. My mom knew what he was doing, trying to help people with addiction, so she reached out to him, hoping that he could help me with my addiction.
Originally, I got to know Don just on TV. Then when I heard that he was incarcerated, my wife and I have been doing a ministry called Cellmate Bible Ministry.
As any inmate knows, mail is a huge, huge thing when you're in prison. It's something you so look forward to every day. Lois and Gary put out an incredibly inspiring newsletter, and it made a huge, huge difference in my attitude while I was incarcerated. It brought hope. And when they presented me with the opportunity to work with Shauna, I felt very honored by that.
I wasn't ready for the help. I just wanted to keep doing what I was doing.
She's been struggling pretty much with alcohol for several years. And we've been seeing a positive change in her life, but it's really the last several months that she's been in contact with Don. She's been growing in the right direction, a positive direction.
In prison, you have an enormous amount of time in your cell to think about your life. And I said, you know, when the opportunity presents itself, once I'm released, I'd like to see, you know, would I be comfortable having a street ministry to help addicted people?
Let's get something to eat first.
My name is Jasmine Johnson. We are in Kensington area of Philadelphia. This is what we would call Needle Park. I was on the streets of Kensington for 6 years, 6 long years. And when I got here, it was like a big playground of drugs, you know, and partying and fun. We ran these streets all around Kensington, doing whatever we needed to get what we needed to get high. I went to jail. The judge sentenced me to go to a program, to a rehab. From there, I was put on methadone, and then I got pregnant with a sugar daddy, you would call it. And I told myself I needed to get it together. I had to learn how to stay sober.
I met Jasmine along with her boyfriend and Aiden, her 3-year-old child. And it was at a time when they were going to methadone treatment at 8th and Girard, but they were homeless.
He came and met us one morning. He met Aiden, fell in love with him. We talked, you know, just getting to know each other. You know, a lot of addicts feel that we're stuck here. Like, it's just a loop that you can't get out of. It's just, this is my life and I'm gonna be like this till I die. He told me that I could still do more with my life. It's very important to have a support group. It's so hard to do it on your own because cravings are gonna come. You're gonna have using dreams. You're gonna have triggers. I could be walking down the street and I see a little cut-off block. Wow, you know, that would be a good spot. The number one thing, you do not want to isolate because your mind is extremely powerful and addiction is cunning.
Having somebody that went through addiction helps me because they know what it's like to struggle. They're not judgmental at all because family for a long time was kind of judgmental and said, you know, just stop.
Be available to someone you've met who's struggling with addiction. Be a good listener. Don't come to someone on the streets of Kensington or North Philly or Germantown and say, hey, here's what you need to do. Ask them what they want to do.
Years ago, I was much more judgmental. I've grown to realize that everything isn't just black and white, cut and dry. Nobody can help them. They have to do it on their own. And until they're ready to take help and move forward, there's nothing you can do. It's quite a struggle. And to see a person get down to the bottom and work their way up, it's really something special.
Prescription drug monitoring programs are seen as one of the tenets to fighting prescription drug abuse across the country. In our state in Pennsylvania, our Department of Health now oversees it. And basically, when pharmacies dispense a controlled substance, whether it be a Schedule 2, 3, 4, or 5, and that covers all your opioids pretty much, it covers all your benzodiazepines, it covers any controlled substance, they have to report it to a state database. And that state database then collects, you know, okay, here's these drugs that were dispensed at all the pharmacies across the state, here's the prescribers that prescribed them. And they have to report that within about a day. So it's kind of real time, if you will. So now what happens is you have all this data in there. It can be used by law enforcement if there's ever a concern, but also prescribers and pharmacists now have access to that and they can go in. So if I have a patient, let's say as a pharmacist that comes in, there's going to be times that I have to query this data depending on what's going on, or I can if I think there's a concern. So what happens is I can go in and see, are people going to multiple doctors and getting multiple prescriptions, you know what I mean, that might interact or might lead to an overdose, or maybe they are doctor shopping and abusing. So it helps catch those kinds of issues, but it also helps clinically as well too. And then doctors that are prescribing can also go on and see too if they've ever gotten anything. Now one of the issues is every state has their own database, okay? So where we are in Erie, we're a half hour from Ohio, we're half hour from New York. So prior, people could cross state lines and we didn't know what was going on. But now the states are starting to share data. So I think Pennsylvania now shares with about 16 states. So I can even see when they're going now to Ohio doctors and getting a controlled substance, and New York or getting it filled there or whatever as well too. So what happens with the PDMPs is the pharmacist or the doctor or the prescriber can go into this while the patient's there or before they see them or while they're attempting to fill their prescription, and they can see what's going on, and that information can be analyzed by the practitioner, and then that can it's a tool in their decision-making process. So if the pharmacist would see, oh wait, you're going to 3 other doctors and you're getting 2 other medications, before I fill this one, I want to talk to these other doctors and make sure that you need all these together or something like that. Or maybe the prescriber queries it and sees, wait a minute, you're also on this medication or something, you know what I mean? So depending on what's going on, if it's truly a clinical problem, then the healthcare providers can communicate. If it's an issue where someone thinks that they're addicted or that they're doctor shopping or something like that, that could be the first step to talk to them about possible treatment or something as well too.
Decisions that addicts make can affect their children for the rest of their lives. We'll visit Hogar Kriya in Freemansburg, where addicts submit to an intense treatment program aimed at restoring the whole person and reclaiming lives. But first, let's meet Lisa Nye, who used heroin until she discovered she was pregnant at 23 weeks, and her baby, who was born dependent on opioids. Stigma prevents some pregnant women from seeking help, the very help that saved the lives of Lisa and her baby.
My preemie baby went through withdrawal. She's 5 days old. Her name is Isabella. I'm in the methadone program, and she's born addicted to the methadone. It was hard to watch her shake and tremor. She receives morphine to help with her withdrawal a few times a day. The 3rd day was the hardest. Yesterday would have been day 4, and it was better, but today's probably the best day. It's day 5. We both started using together, and then from the Percocet, they're expensive, and that led to heroin. Heroin's cheap, and it was just snowball effect. It was horrible. He's incarcerated for some of the stuff that the opiates caused him to do. Waking up, it's a struggle. All you can think about is, how am I not going to be sick today? How am I going to get the money? What do I have to do to get that money? It's disgusting. it's not a way of life. I wouldn't wish it on anybody. And I used up until I found out I was pregnant with her, and I was 23 weeks along. Just because of the judgmental people out there, like, she's using and she's pregnant, but when you're pregnant and you're using, you can't stop. I was ashamed because I was using while pregnant. I was scared. I didn't want people to know, because I don't want someone to take my child from me because of a choice I made and now I'm an addict. I'm in treatment with roughly 6 to 8 women. There's probably hundreds of women out there, and they're scared. They don't want to be judged. They don't want that fear of their baby getting taken away. I just wanted to do whatever it took. I'm over 90 days sober. I feel good. I don't know, seeing your child through sober eyes is, I don't know, it's awesome. She knows that we were sick and we had to go to a special hospital with special doctors. But I'm ready to have her back and let my mom be a grandma again instead of a mom. I'm excited because I'm sober. As soon as I find housing, like, we can be a family again, and it's like a second chance. I can start over, like a clean slate.
Before I came in here, I had a couple months, I was just out on the street after they took my daughter away. I struggled getting clean and staying clean for my whole life. So, my name is Jeremy Wheaton. I'm 35 years old. I'm from Palmerton, Pennsylvania. I came here about 22 months ago. They opened the doors, welcomed me. You know, I was resistant at first, but you know, as soon as I started, you know, submitting to the program and doing what I had to do, I started changing everything about myself.
Hogar Crea is a therapeutic community. We call it Hogar, meaning home, and Crea is the center for the education of the character. That's what we call Hogar Crea. After 20 months, we guarantee if they go through the process, you will have a new member of the society that would know what is the role in society. You know, they have to learn how to get familiar with the rules and regulations of the programs.
How you doing, Pedro?
All right.
Your surgery all right?
Need a little
Good?
more better.
All right. A little more better. Hogar Crea, Freemansburg, Brian speaking. How can I help you? And how much is the fee? What makes this program different is that, like I said, you're doing it for yourself, and they put it all on you. It's your accountability, your responsibility to do anything in the program. They're not going to force you to do anything at all, but they want you to take initiative to do the things that you need to do to better your life. Well, it's designed to make a structure out of your life, to have accountability and responsibility. We do work brigades. We go and do landscaping brigades. We do moving brigades. We work at warehouses. We do the sale of our baked goods. We do everything we can think of.
You are in charge of a whole home, not just yourself. You got 20 residents, more and more, that you have to take care of and make sure that everything gets done the way it's supposed to. You have to manage, you know, the house. You got to make sure bills are paid. You got to make sure that the guys are getting therapies, and you know, you're managing the food, everything. You know, I have a little girl that I'm going to be taking care of, so it really taught me that okay, I can take care of our house. I can take care of her. When you go to another facility, they don't give you that much responsibility. One, it made me feel good that people were trusting me again. when you're in addiction, you lose a lot of trust from a lot of people. I think in recovery, you need that part too. That really helps to have that responsibility to be able to know that you can do this. You have that responsibility, take care of things.
With opiate addiction, it takes 18 months to actually rid it of yourself. It's why longevity here it's really important, because if you're not going to be here for long term, you're not going to change. This was the first program that would accept me as a long-term solution to my problem. But you have to be strong. If you're not, I mean, what's the point of being here? Until someone says, look, I've had enough. And when they do, this place is waiting. It's always going to be here.
Living in isolated rural counties of Pennsylvania poses unique challenges to those seeking treatment. Medication-assisted treatment is called the gold standard of addiction care by its advocates. However, negative public perceptions surround this form of treatment. We'll travel to Center County to meet Jamie Durst, who discusses receiving the treatment she describes as life-changing. But first, hear the story of one community agency that is working to make recovery treatment more effective for those who choose that path.
In a rural community, if you're seeking treatment for an addiction problem, one of the biggest barriers is simply locating a provider who can help you and then getting to the provider.
In northeastern Pennsylvania, there's only a handful of licensed step-down services.
Just for example, in Susquehanna County, there are 2 sites where there's addiction recovery counseling available, one in Montrose and one in Susquehanna. But if you live any place else in that county and you want help for that problem, you've got a lot of traveling to do. I know that someone had wanted to open an addiction recovery center in Susquehanna prior to the hospital opening one, and they ran into some pushback from the local community.
There is that not in my backyard mentality. I don't want those type of people coming into my backyard. Those individuals are already here in your community. They're just untreated.
Addicts are a hugely diverse group of people. Upper class, lower class, doesn't make a big difference.
In northeastern Pennsylvania, it wasn't taking place in bedroom communities. Well, now all of a sudden it did.
And a lot of patients are started on prescription medications, but not by a doctor. They go to a party and somebody's got a bottle of prescription medications and they're passing them out. And that's how a lot of people get started.
It's not a walk-away drug. Your body becomes physically dependent on those medications.
It's not a question of getting high anymore. This is a question of just feeling normal. We've partnered with the local drug and alcohol counseling program, which is called Rehab. This guy comes into the emergency room, he's had an overdose. And in the old days, the ER doctor, which might be me, would get him through his overdose, and we'd give him some recovery material, call these people in the morning, and about 40% of those people might actually make the phone call the next morning and try to get some recovery. A warm handoff is a relatively new term. That same person comes in, and as soon as they're identified as someone who has an addiction issue, they pick up the phone and call the certified recovery specialist. And those people show up, start the counseling immediately. If medication is needed, you provide the medication then. So instead of hoping they'll call tomorrow and get them in, you get in and you get started right away. You get about an 80% response rate instead of a 40% response rate.
Even when you have treatment services available across the street, the engagement level has a lot to do with the individual's willingness to want to get help.
If you're thinking about pursuing recovery and you haven't made that step yet, call one of the counseling programs. Get in, get evaluated. You may find out that it's something you want to do that very day, or you may decide, I'm going to keep talking to them, it sounds good. Maybe I'll turn around in a week or a month. If you don't pick up the phone and call a counselor, get in and see a counselor, then the next time you get in to see someone is going to be when you overdose, when you go to jail, when your family says you can't come home anymore.
You don't realize how great it is when you're able to be the person you're supposed to be.
If you have enough motivation to even call a counselor, they can usually help you out.
Addiction is a brain disorder. It is a disease, and I know a lot of people challenge that. If someone could stop that easily, they would. Nobody wants to be controlled 24/7 by a drug that they're spending so much time and money chasing and obsessed with to make them feel normal.
For me to describe withdrawal, it is basically having flu symptoms times 100. You get the headaches, and then you have the chills, and then, you bowel problems, and, you're vomiting.
Seeing a person go through opiate withdrawal is a pretty horrific experience, and it isn't something you would wish on anyone. Medicated assisted treatment is using a medication to help those who suffer with opioid use disorder. It helps with their cravings and withdrawal symptoms. It allows them to focus and function normally and allows them to engage in treatment better so we can begin their recovery process.
I didn't get hooked on drugs and alcohol till later on in life, till I was like 28 years old. And I don't know how that started. It was just some of the people that I was hanging with, and I would I would try it, and then all of a sudden, it became really bad. I actually Googled doctors in the State College area, and this number came up, and I was desperate, so I called it. I'm like, I need help. And it's hard to ask for help, I take 2 a day. I take 1 in the morning and 1 in the afternoon. I don't get high off of it. If you're doing it the right way and you're on this program and you're doing it right, you don't get high off of anything. You don't want to. That's the whole purpose of not coming to here, is not to get high.
Coming in for medicated assisted treatments, we don't look at just giving the client medication. We look at the patient as a whole. In addition to the medication, there is also individual therapy, and then there's group therapy that goes along with that. All the data shows that for opioid use disorder, you have a higher rate of achieving recovery and staying in recovery long-term with medicated assisted treatment coupled with therapy. I've seen success in the other levels of care, but I haven't seen long-term success like I see in medicated assisted treatment.
Since I've been on it, I've gotten a house, I have my car, and I've worked at my job for 3.5 years. That's awesome, but I'm a different person. So you have to just make yourself a better person every day. You know what I mean? You gotta live with the moment. Sometimes it takes minute by minute, second by second. But you just got to get up and just try to be the better person than you were before the next day. That's what I do.
Is opioid abuse dependency genetic? Could the proper disposal of medications help curb this epidemic? Coming up, you'll meet Brenda Goldman, a mom who not only battled addiction, but now has kids who suffer as well. Could a test detect if someone is at risk for developing a drug dependency? But first, find out why drug take-back boxes are an important focus on alleviating concerns of prescription drug abuse by helping us properly dispose of unused prescription medications.
So medication disposal is also one of the major ways to try and help deal with the epidemic. There's lots of ways to deal with the epidemic, right? Like I said, there's enforcement, there's treatment, there's prevention. So one of the issues is, and there's studies out there that shows that, let's say you or myself go and get a medication because we had a root canal or something, and we maybe got 30 pain medications, pills, and we only use 3 or 5 of them. And if we leave those laying around our house, that's a source of diversion. It might be someone in your family, it might be friends that visit you, it might be someone that comes to work in your house or something like that. So really, we want people to get medication out of their home that they no longer need or using or are expired. And there's some people out there that have a lot of medication in their home, like if they have cancer or something like that, they have a lot of pain medications. Now there's a lot of attention put on what's the best way to dispose of medications. So taking the environmental factors, taking the fact that we want people to dispose of medications as soon as they can. And it's just not controlled substances, it's really any medications. So basically, whenever patients or people are done with their medications, we want them to dispose of them. So these boxes are a way for them to bring it to us at local law enforcement. It's a couple pharmacies around our town have them as well. They're around the state. The state attorney general has funded some at a lot of the state police barracks as well too. They can drop it off there. Then those are collected currently through the National Guard, and then they are incinerated. And incineration is much safer for the environment, and it's paid for as well, I think, through the state. So the whole philosophy is get unneeded medications out of the home because we don't want people diverting them, abusing them, or maybe having a poisoning issue with them or whatever. And then that's probably the best way for the environment as well. And across our state, probably since around 2010 or 11 or so, there's been this heightened attention on best disposal practices. And then when these boxes started and we were advertising them and stuff, as well as the DEA does a take-back event twice a year too, and it's the same thing kind of as the box. You know, we would see more and more drugs come in every time. We were just shocked. And I think this last DEA take-back that they had was the most that they ever collected as well too. So I think as a society, people are listening and they're realizing, oh, this is something important not only for me to help protect against poisonings, diversion, the environment, everything. So I think in general, most people are very sensitive to it and they want to do the right thing. So yeah, we've continued to see it be used. And at first we thought it would kind of dip down, but there's always drugs being prescribed, always people cleaning out their cabinets, if you will. People go through issues like, you know, acute illnesses or whatever. So it has really been a good program that has continued to collect a lot of medications each time, and it doesn't seem to be slowing down.
The question is, why are people developing dependency? Some people developing dependency, others aren't. What's the difference? For instance, as little as 3 days of an oral opioid into 1 year, 1 in 16 to 1 in 10 of patients are going to be dependent upon that drug. Why is that?
When I was about 15, I started drinking. And then as I graduated from school, then it went into marijuana, the cocaine, the crack, the Quaaludes. So I was abuser. I was an abuser of drugs and alcohol. I have 9 boys and 2 girls. My oldest son struggles with heroin, and he really struggled with that for about 10, 12 years, started with opiates in school. And then I have another son who really struggled with marijuana and opiates. And then I have another son who also dabbles with the opiates. Each of them have been in and out of jail and in recovery. And I can say today, though, they are doing quite well.
It's well known and well characterized in the already peer-reviewed literature that somewhere in the neighborhood of 50% of substance use disorders can be due to genetics. Come on. LifeKit Predict is a branded name of a very specific test. And it doesn't tell you definitively that you will develop a substance use disorder. What it does do is objectively allows classification of a patient based upon their genes alone as similar to a group with an opioid use disorder or not. What we're working through right now is how you go through and use that information to appropriately change clinical practice.
When a loved one is using, it has such a stronghold on them. They walk away from family, they walk away from everything they know to continue to satisfy that craving that has a grip. Here I am, I abused drugs, and when trouble came, I had the sense to, and the ability to say, okay, you know what? I gotta walk away from this. Enough, it's over, time to grow up. My sons can't do that. It is not my oldest son's desire to not have a full life.
We truly believe in shared decision-making, allowing a patient and a provider to have a discussion where they can objectively understand what the differences in clinical pathways are. We think it would be interesting to have the patient-provider discussion. Your genes are very similar to a group with an opioid use disorder. Let's talk about how that may affect you. Let's talk about how that may decide different pathways here in your care. And we believe that this test is an objective classifier that should be there when that discussion's happening.
If you could have that testing and then prescribe the right pain medication, I think it would be such a benefit to our society in this epidemic.
When a person is overdosing on an opioid, breathing can slow down or even stop, and it can be very hard to wake him or her. Naloxone or Narcan is an opiate antidote. Eric Phillips owes his life to naloxone. He's been revived multiple times with the overdose antidote, which is accessible to most people in Pennsylvania at pharmacies. This segment explains what happens to the body when someone uses opioids and how the antidote can reverse the effect of an opioid overdose.
I am Eric Phillips. I'm a recovering addict and alcoholic. There's probably been times that I've gotten naloxone used on me that I don't even know. It probably was needed. It could have saved my life.
Narcan is the life-saving drug for individuals when they have overdosed from an opiate, and it can reverse the effects of the overdose and literally bring someone back to life.
Naloxone is the generic name. Narcan is the brand name that it's sold under.
A standing order takes away one of the hardest things that an individual needs to get a prescription medication, and that's the actual prescription. Normally, if someone needs to get a prescription medication, they have to call their doctor, go visit their doctor, get that piece of paper, or have their doctor call it in or send in an order, and then go to the pharmacy and get it. With the standing order, that whole step is bypassed.
I think the standing order is a great thing. We want to make sure that as many people who need naloxone are able to get naloxone.
You know, and I know there's probably mixed views about it. People saying, oh, if it's available, they can use more. And everybody does that with everything, whether it's a cell phone or it's whatever.
I think it's a good idea. Certainly, if there's any way to save someone who's overdosing, then you want to give them another chance.
Treatment's not going to work if you're dead. So by saving somebody with naloxone, you're giving that individual, that family, one more opportunity to go into treatment.
As a physician, I saw this as a really tangible tool that could be put to immediate use in the fight against this disease. It took some readjustment for folks, but now I think that there's a relative, I'm not going to say it's perfect, but I think a relatively smooth process out there for most people. The individual would literally just go up to the pharmacy counter and say, I would like a prescription of naloxone, and the pharmacy would get their name. They do have to take the person's name, and then if they have some kind of insurance, whatever it is, it can be Medicaid or any of the private health insurers, they would need that insurance information, or the person could choose to just pay cash. That's pretty much it.
It is a simple procedure to use this medication.
There's the intranasal, so that's what we use, and then there's the injectable. So the injectable works similar to like an EpiPen, but we distribute the intranasal.
The intranasal method is simple, and anyone can do that.
It's a very small unit, 2 squirts up the nose.
The intranasal method takes anywhere from 2 to 5 minutes to work.
If the person is not breathing, the spray will work because it is absorbed in the membrane of the nose.
I think it's a good thing to have. Family members of addicts or people who abuse prescription medication should have it with them.
As long as it is an opiate that you think that that person is abusing, an individual should have Narcan on hand for that person.
I think it's important that people understand better what naloxone, what Narcan is, what it can do. And they should avail themselves of the opportunity to use it.
So, over the last, say, 15 years here in town, we've used to see a surge of heroin and some opiates at one point in time, then it really fizzled out, and then it's really come back with a vengeance over the past, say, maybe 5 years or so. And probably the last 2 years, it's really become to surmountable levels. More and more, we're seeing younger patients coming through who are in cardiac arrest, and no matter what we can do, you can't bring people back from the dead generally. Now they will wake up with the antidote that's on the street, that we've made much more available for folks, But there's going to be a point in time in a condition when that antidote doesn't work for that patient. And just because an antidote's out there doesn't give somebody liberal use to then go start using the drugs because the antidotes are around on the street. Again, if people use a certain amount of the drug, the antidote won't work. So how an overdose happens can happen just by ingesting pills, snorting, injecting, popping, and so on. The antidote potentially works up in the brain cells to block the receptor where that prescription drug or opiate or heroin is going to work, and basically blocks that effect of the drug. And if a patient is essentially apneic, meaning not breathing, it'll wake them up very quickly. But again, it's only at a point in time where other effects haven't happened. If it's too late in the game, it would essentially not have an effect because the metabolic changes in your body would already occur to lead you to death. So it does have benefit. It works either through an injection, they can give it to you down a tube, you can actually use a nasal spray that they have today, and it is very effective. But again, its effectiveness has to be out there with a caution that just because you have an effective drug to treat your overdose shouldn't give you the comfort that you can overdose and someone's going to save your life. There will be people that die because the antidote is not strong enough or doesn't have enough time to work because whatever you did already took effect.
Throughout the past hour, you've heard stories of struggle, but also stories of those who are now in a much better place. For them, staying clean is hard work and a source of great pride. Where do they go to stay on the right track? Well, in Washington, Pennsylvania, Chris's room bears the name of a young man who inspired it. Overcoming opioid addiction is no easy task, but in this next segment, you'll see how through community support, hobbies, and personal strength, there is hope for recovery.
I'm Beth, and this is Bill, our mom and dad of our son Chris Wall. This picture was taken of him when he was graduating from high school, but tragically Chris died when he was 33 years old from a heroin fentanyl overdose. He went to Penn State and graduated with an industrial engineering degree.
We wanted to be upfront because there's no sense hiding from it. It's a disease. Chris touched a lot of people, and they saw the obituary and wanted to contribute.
So this room was created in the memory of our son Chris as a place of respite for people who are in treatment for addiction. There were gaps during the course of treatment, and I think this room helps kind of bridge that gap. You cannot allow people to go in for 3 days for detox and maybe 3 weeks and then you're out on the street again.
This room is a safe place for me. I've seen people sleep in here, people doing their laundry, showering, eating, and just being able to sit down and talk to someone, listening to someone, giving them advice is hugely beneficial to me and my recovery.
It's just so nice to have this back here. You know, even just to find a book and sit and read the book and, you know, relax for a minute.
These stones, which represent loved ones who have been lost as a result of drug abuse. This stone right here with Jessica written on it. Jessica was an ex-girlfriend of mine who died of heroin overdose. Lots of things trigger my anxiety, and coming to this room, I'm able to get away from the hustle and bustle of everyday life.
I come here just to get out of the cold. There's always, a place to rest.
People call people in Chris's situation, they call them junkies. And junkie is a terrible term to use for someone who's battling addiction, battling a disease.
Remember, Chris says,
I just hate people look at me like I'm broken. The bottom line is we have to get rid of the stigma so that people can seek the treatment that they need and the support from everyone around them.
It's a tragedy what happened to the son, but for them to do something, such a great memory of him, to help out someone like me.
Even though they lost their son, they're still willing to help other people in recovery.
If this place wasn't here, I don't know where I'd be. I might be dead right now.
It makes me proud, in a sense, that he touched so many lives. If there's anything good that can come of this, maybe this is it.
I think he'd love this.
He would.
Yeah. I think he'd think it would be awesome.
Hi, my name is Joey Pagano, and I've been clean since February 1st, 2013. When I was young, I used to play the guitar, and I played acoustic guitar for a long time, and I lost that hobby. Once I got clean and I started on that path, and I played guitar, and that hobby kept me going for such a long time.
My name is Janae DeCantis. I've been clean since January 5th, 2010. I really would just reach out to other people and say, hey, like, I really don't know if I can stay clean today, like, can you help me? I really had to have somebody literally hold my hand until I didn't have those urges as much anymore.
My name is Danny Connell. I have 1,218 days clean. I vape a lot. You know, like, it's more of like a hobby now for me. I like to travel, like go to conventions. I have a lot of passion behind it, you know, and I mean, honestly, that's honestly what I do.
My name is Mindy McCloy. I've been clean since January 29th, 2014. I stay clean for myself, but whenever there's days that I have, you know, it's really tough to get through, I look at my daughter and she's like, puts a smile back on my face.
My name is Brian Issy, and I've been clean for almost 4 years now. My hopes going forward, I hope to show people that, you know, recovery's possible, and, you know, I didn't feel like I could go and open up about what I was dealing with, so I tried to hide it. So I want to show people that, you know, there's a place you can go.
By the grace of God, I've been clean and sober since February the 6th, 2015. I missed out on a lot of key events in my daughter's life. Our relationship today, I can't say enough about it. It's beautiful. My first Mother's Day card she gave me that said, "I love you, Mom," made me cry because I didn't know she could ever feel that way about me.
My name is Chelsea Hill. I've been clean for 8 years. I go to the gym almost every morning, which sounds kind of silly, but it's a great time for me to get recentered with myself.
It's a beautiful thing to get clean, but it's an even more beautiful thing to help somebody and be able to watch them get clean.
And I remembered I wanted to just make a difference one time, not only in my life, let my family be able to sleep, you know, and just live a life where my parents, myself, and God could be proud of me.
This program is the first collaboration where all 7 Pennsylvania public media stations are using each of our media platforms to bring awareness to this serious issue. Our hope is that through our efforts, citizens will have access and information on where to get help and to save lives. On behalf of Pennsylvania Public Media, I'm Paula Giangiacomo. Thank you for watching.
Major funding for Battling Opioids has been provided by...
It doesn't take long to become addicted to opioids. In fact, 13 Pennsylvanians die from them every day. Geisinger is committed to ending opioid addiction with both prevention and treatment. In the last 3 years, we've reduced the amount of opioids we prescribe by 50%, and we've opened 3 medication-assisted treatment centers to help patients recover from addiction. Learn more at geisinger.org/hadenough.
Additional support has been provided by the Commonwealth of Pennsylvania and viewers like you. Thank you.